Hello, thank you for joining us for this presentation of West Virginia State University Healthy Grandfamilies Program. Grandfamilies are another epidemic in our country, an epidemic in the state of West Virginia, and a new community that we are very proud to work with. I'm Dr. Kerri Steele. I'm the Associate Professor and Chair in the Department of Social Work at West Virginia State University.
Hello, folks. I'm Bonnie Dunn. I am the State Specialist for Healthy Grandfamilies, and it's a pleasure to join and be with you today. We're going to get started by talking about Healthy Grandfamilies Program. We discovered during the pandemic that it was far more than a program. As you'll see later in our model, here's how we came about our thinking on this, that it's more about services. So it's support services. We're about advocacy. We are about intervention. And we also are the point of contact when the grandparent needs an answer.
So just to set up kind of some national trends for grandfamilies, we know that there are over 2.5 million grandparents that are responsible for their grandchildren. That is a conservative estimate with the best numbers that we have available. We know that for every one grandchild or every one child in the foster care system, 25 are being raised by their grandparents or relatives outside of the foster care system. The best estimate we have is that grandfamilies save taxpayers more than $6.5 billion a year by keeping kids out of the foster care system. And just for your all's information, West Virginia currently ranks second among all states in the percent of grandparents that are responsible for their grandchildren. We, in our pilot program with Healthy Grandfamilies, worked very closely with our grandparents to discover some demographics. And so we found out that there are many common reasons that grandparents are raising their grandchildren. There is the death of the parent. There's neglect, abuse, or violence in the home. There was money, the parents not being able to afford to raise their children, incarceration, illness or disability. And in West Virginia, the number one cause that we found, 80% among our pilot families, was substance abuse as the reason for grandchildren living in their grandparents' home and being raised by their grandparents. There were also some common challenges that we found among our grandfamilies. Common challenges, the number one was legal status. Grandparents not having or knowing where to go to get legal responsibility and guardianship for their children. There were concerns about the children's behavior. Of course, money is always a factor when you're dealing with the state of West Virginia. There were concerns about health care for both our grandparents and our grandchildren. There were issues with the school system. And another one that came up quite often was relationships or trauma. And so please keep in mind, as we talk about the Healthy Grandfamilies Program, that grandparents most often had their grandchildren because the grandparents' own children couldn't raise them anymore. So there's familial trauma in the folks that we're working with. In terms of the intervention for the Healthy Grandfamilies Program, in our initial planning, our initial model, grandparents got education and an action plan for 3 months. Part of that education was to bring the folks together in discussion groups. And there would be these weekly discussion groups for grandparents that were delivered in the community where they lived. That was a very important factor. Topics that we covered in these discussion groups were communication, parenting in the 21st century, family relationships, nutrition, navigating the legal system, navigating the school system, social media and technology assistance, health literacy, self-care, stress management, and family response to addiction. On site with our discussion groups, we also provided childcare and refreshments to make it a little easier for our families to be able to attend. And then the family support, the support that we build with the social work services was a follow-up for 3 months after those discussion groups. So in our initial pilot program, the initial model we put together, we had a total intervention of 6 months. And then COVID hit and we had to recalibrate and edit and change the way that we were doing some things. So under COVID, instead of a 3-month action plan, we took off the timelines. And so the education piece was still there. We still had the discussion groups to the best of our ability, whether that was over the phone or over Zoom or over the internet. We had phone calls and check-ins to make sure that our families were doing okay. If they needed anything, we helped to provide money and assistance with food, with clothing, with gasoline, getting bills paid. Phone calls were made by the coalition coordinator in each of our counties, or they were made by the social worker in each of our counties, or anyone on the team who was willing to help out and provide these courtesy calls of encouragement and do you need anything? And there's somebody that you can talk to. Just wanted to see if you're doing okay. We had a few counties in West Virginia that moved forward with doing the discussion groups over a virtual platform, over Zoom or Google Meet. These were not super popular. West Virginia doesn't have notoriously good internet connection. We don't have families that all have a computer that can keep up with something like Zoom or Google Meet. So we have pivoted and are doing our best to keep to the original model in terms of education and support groups and bringing the grandparents together so that they know that they're not alone in this situation. With the family support follow-up, what we discovered in COVID is that, again, no timeline is needed. So moving forward with our model, we're going to remove the 3-month timeline on follow-up. There are some of our grand families that need us for 2 or 3 weeks, and there are some of our grand families that need us for 2 years. So we have discovered with COVID that getting rid of that timeline really lets us provide individualized care and quality care for the grand families that we're working with.
Well, let's talk about outcomes. 2-year post the ending date of our 3-year pilot project, we sent out the 125 surveys to the 125 cohorts that we had during the pilot. And 80% of the grandparents who completed the program reported a decrease of those common challenges. We were so excited when these surveys started coming in, and we discovered that they had positive impacts on these families. And some of those were the financial burdens, self-care, privacy, feeling tied down, a lack of sleep, difficulty parenting, and custody issues. If you recall the topics that Kerri went over, we talked about the navigating the legal system, which is something that Legal Aid of West Virginia, one of our partners, helped them with obtaining guardianship or whatever level of custody they needed. The financial burden, it's not that we have so much money to give them, but we led them to a TANF West Virginia Works Child Only resource through DHHR that they didn't know they were eligible for. And so we helped them apply and receive a monthly check. However small it was more than they were getting. All discussion groups were found to be effective in the pilot, with the most popular was parenting, family relationships, communication, nutrition, and health literacy. The health literacy piece is about tracking your own health history and making sure you're taking your medications and going to the doctor, because we discovered during the pilot that so many of our grandparents, as a matter of fact, 100% of the 125 cohorts all presented with one officially diagnosed chronic illness. 60% of them requested help with concrete services, and 34% requested help with legal services. 98% found the program to be helpful and would highly recommend the program to other grandparents. Replication. So the program piloted in the Greater Kanawha Valley in 2015. Harrison County, which is in about the middle part of the state of West Virginia, served as the pilot for expansion. By December 2019, the program had been replicated in all 55 counties in West Virginia. I had a wonderful time going around the state and training the counties. Other areas trained in replication include the University of New Hampshire Extension Service, Kentucky State University Extension Service, the University of Guam Extension Service, and Kin and Kids Consulting in Chesapeake, Virginia. Successful replication requires community support and resources. County coalition leaders and the coalition members, identifying community resources, discussion group leaders, community social workers, and volunteers for food and child care. In conclusion, West Virginia State University Healthy Grandfamilies Programs addresses a vulnerable growing population. This is a non-threatening approach with high completion rates. The program has shown positive outcomes. The model is easily replicable, and what has been created is now giving grandparents raising grandchildren a voice that is being heard, recognized, and supported by our state government and a broad cross-section of foundations and social service agencies. For more information about our program, go to healthygrandfamilies.com, and I always say that you will find more than you ever wanted to know about the concept of grandfamilies and what we are doing in the great state of West Virginia to support these families that are ever growing. Keep in mind, so as the drug epidemic rises, so does the grandfamilies numbers. Thank you for being with us today. We hope that you have learned something from our presentation.